Hello, Dr. Priya Mistry. How are you today?
I'm well. I'm
You,
so
you,
happy to see you with my favorite faces. Thank you for having me.
well, we are so honored, Pam and I, to have the queen of TMJ social media to let us know how we can help patients from afar, which you do. Is that correct?
Yes, yes.
So I am retired, as Pam knows, and she's jealous of the fact that I'm retired.
It's true.
And watching social media, this old guy, and I keep seeing this beautiful woman talking about TMJ, and it would be
Must be Pam. Must be Pam.
all these,
Thanks,
I
Priya.
mean, everywhere, TikTok and Instagram and everywhere. And I said, wow, I got to meet that person. So I don't remember how I contacted you, but you responded, and I think we had a FaceTime chat and talked, and so ever since then, we've been pretty well connected on what we all do. And so now I want you to take it from there on how you and I and Pam and ICMO all got together. And then also for you to share with the audience a little bit about your history on how you learned what Pam and I talk about for on and on and on for 2 years now.
Okay. Yeah, so um you reached out to me, Mac, after you saw my how to take an aqualizer bite video. And it was interesting because as I was growing on YouTube, because that's where I started, a lot of TMJ dentists, well, maybe not a lot, maybe like four or five reached out to me and they wanted to set up a FaceTime call with me and just talk, right? But four out of five of them were like mansplaining to me. They were talking at me. They weren't asking about me or my opinions or anything. They were basically just telling me how to treat TMD. And I thought that was kind of annoying. And you were like the fifth one. And I said, okay, I'll do this one more time, but I don't have much hope for these men anymore. And you did not mansplain to me. You told me, you said, I love your video. And I want to offer you a way that you can take the aqualizer bite in a little bit of a different way. And then you told me about the phonation, the counting 66, 67, 68, 69. And I made an updated video to that. And we had a real conversation. It wasn't just a monologue coming at me. So thank you for that. And I just knew after that conversation, I had to meet you and I really liked you, respected you, admired you. And then I was finally able to go to ICMO in Calgary. And that's where I met Pam and you in person for the first time. And I was so excited to meet you guys. And I remember I was coming back from the gym and I looked awful, like no makeup, hair wasn't done. And that's when I met you guys. I was like, no. I was like, oh, I'm so embarrassed. But you guys were so kind and so lovely. And you just welcomed me, all of you really, with open arms. And I felt like I had found my people. So that ICMO will always stand out in my mind as like when I finally met you, Pam, you, Matt, Alex, everyone. And prior to that, my kids were very, very young. They're 7 and 9 now, and that ICMO was like 3, 4 years ago. So they've grown. But prior to that, I was learning with Dr. Arthur Parker, who's like my TMJ mentor. And he was part of ICMO, but he was very under the radar. He was like opposite of me, like soft spoken, under the radar, didn't want to publicize what he was doing. But when I saw how many people he helped, I was really inspired to start creating content for those people because when they came to see us, they would say, why is there no information out there about this? One, why does my physician not know about this? My nobody knows about this. My dentist didn't know about what you guys do and how you can treat TMD so successfully. So that really inspired me during quarantine to start a YouTube channel because I was just sitting there twiddling my thumbs, stressed out about money, stressed out about life. And Dr. Parker said, let's all come up with a way on how we can keep this business alive, right? Because we are taking care of people, but it is a business. If you can't afford to pay the bills, the doors ain't going to stay open.
Right.
So he wrote a book, a small booklet about TMD management at home. Everybody had ideas like Facebook ads, Google ads. And my one idea was, I'll start a YouTube channel. And he was very skeptical. But 9 months after the first video was released, and I released a video a week. That's a lot of work. I edited those myself. I posted them. I figured out how to post them on YouTube, which is also a ton of work. So I did one a week because we were so slow that I could do it all at work and not have to commit time at home to those videos. But 9 months to the day after I posted my first one, someone walked in and said they found us off of YouTube. And Dr. Parker's jaw fell to the ground and he said, wonderful, you know? So it kind of took off from there.
Can I just share with our viewers and our listeners? Priya is an amazing dentist that's had tremendous success in helping so many patients that suffer from TMJ issues. And aside from her as a clinician, what I think is just profound is that she has gained a global reach. That she has so many people that find her on TikTok and YouTube and other social media platforms. And I think that's beautiful because it's important. So many of our listeners and watchers are suffering, and they've been told that this is something they just have to deal with, and it's just stress, or they're going to, it will pass, and they think they're crazy. And so when you are putting out that content, and at first there is no monetary gain from it, you're doing it altruistically to help, but then also to draw people to come and be able to find you, and not just you. You've also referred patients to me and other colleagues because not everybody is willing to fly out to always see you. So I know you genuinely want to help. And honestly, like, thank you. That's just tremendous. And now aside from treating patients in your office, you are doing your best to teach other doctors as well on how you specifically treat TMJ in your office. So if somebody is listening and watching right now, she is, by the way, you're based in Seattle, right, Priya? God,
So
no.
I'm in Vancouver, which is just 10 miles north of Portland.
Okay, all right. I don't know why I had that in
Washington.
my head. Okay, all right. So, if somebody is listening and wants to seek you, like how can they get in touch with you? Like what's that look like when a patient reaches out to your office? What does that look like?
Yeah, so actually, not a lot of the people that are not local to here reach out via calling the office. They actually DM me on Instagram or YouTube or something, and I just say, if you want to schedule an online consultation with me, here's the link, or you can call my office and get that set up. And then they kind of take it from there. But uh, there's a link that you can schedule with online on the office website. Or you can call the office alternatively and see usually if you call the office, I can get you in a little sooner for an online consult. So I would recommend that. But during that initial consultation, I have them fill out extensive paperwork because Dr. Parker, my mentor, always said, um, the mysteries in history. And the history can tell you so much. Like, for example, an easy history is I had popping in prison for years. I woke up one morning, the popping was gone, and I can barely open my mouth. We know the jaw is locked closed. We know that's this displacement without reduction. That's sort of a no-brainer, right? So when I sit down and ask them all these questions, usually by the end I can have at least a preliminary kind of diagnosis, like a differential diagnosis. And then I tell them whether I can help them or not. And then they make the decision to either come to see me. But there's only a handful of people I refer to, Pam. Like you're one of them, Dr. Rahman, Dr. Alexander George, because I've referred to other people outside of that small group, and I haven't liked what I've heard. People have gotten mad at me. So I'm very scared to now send them to a website or this way or that way. I just keep my group very small because I know you guys can take care of them. And I'm not saying no one else can. I'm a, I just am a little bit afraid to make a lot of referrals when I don't know necessarily exactly how they feel.
Oh, that makes a lot of sense.
Yeah, you agree. So I was still practicing when I met Priya, and this is the last year, and she also referred people to me.
I never
And
did.
yeah, you did. And you're 100% right. I am very reluctant to recommend a dentist that I hadn't either been in their office or I haven't sat down with them and talked and know exactly what they do, even though they might be a member of ICMO. And that's the reason for the fellowship. And you pain sufferers, you can go to ICMO.org and look for somebody in your area that does what the three of us do. But be sure you look for somebody that has their fellowship because they've been vetted. They've had to meet with the college. They had to prove to themselves that they do what we do and they're just not lip service.
Yeah.
And it's really hard to help people and guide them on what to do. So we have these podcasts and I've written my books, to educate them so they know what to look for when they're seeking help from a dentist. And
Mhm.
this podcast is all about helping the pain patient with their own pain, self-help, and how to find the right dentist.
Yes. Yes.
So Priya, I know your patient pool is predominantly adults still. Is that correct? Like maybe teens and up, right? So when somebody comes to you and as part of your intake, what does that look like? When they walk into your practice, what's part of your initial intake aside from sitting down, being super thorough about understanding their history? Agreed, agreed, and agreed.
Yeah. Yeah,
What
that's
do you do
the
from
first
there?
step. I hear their whole story. And then we do a thorough physical exam. So I start with a range of motion where I check opening, movement of the jaw, right and left and forward, right? And then I do a really thorough muscle palpation exam. And what a lot of patients tell me is they either, if they had seen other TMJ dentists before me, they were like, nobody palpated my muscles. Like this guy didn't even touch me. He looked at me and said, I'll make you a splint. And I hate the word splint, by the way. It doesn't even mean anything. It can mean orthotic, like a true orthotic, or it can mean an iPod, or it can just mean some crappy oral appliance. So I don't even use that word, right? But they'll say nobody did a palpation exam. Just yesterday, I had a patient tell me the assistant did the palpation exam and they were just barely doing this. Like they weren't using proper pressure in the right areas. And so the palpation exam is pretty tough. It tells us if those muscles are healthy or if they're not. So I spend a lot of time on feeling the muscles in the head, neck, jaw, inside the mouth, and then I palpate the joints. I actually feel the joints from the outside and from the inside. We do a postural exam with them standing up against a grid, and with them lying down. I'm checking leg length, and then I look at the occlusion, of course, the bite. I'm looking at the bite. I'm writing down what I see inside the mouth, scalloping on the lateral borders of the tongue, mandibular tori. Sometimes you see these bony exostoses. Those are big bumps on the gums on the cheek side, and sometimes they are like literal shells. They are shelves of bone that are built up to counteract the forces of tension and binding. And these patients don't even know they have that. They
Right.
don't even know that's not normal because they develop slowly over time. But when I see those, I point those out to my assistant that's taking notes. I'm like, come look at these shelves. And then it gets the patient like, wait, what are you looking at? Like, why are you calling over here? And then we explain what that is and how that developed and why that is. And sometimes what's crazy is some of these people don't even know they've been punching.
Right.
And they're like, oh, that's what I did. I'm like, yeah, that's a bony buttress to counteract the forces of clenching. So we do a thorough intraoral exam, and then I usually have a pretty good idea of what's going on. So I don't do imaging without a thing. I then explain that to them my diagnosis and my treatment, and then when they come back for the workup appointment, that's when I do a CBCT scan, et cetera, et cetera, et cetera.
Okay. And so, what are your thoughts? Because we had, Dr. Bob Meyer on before, and he was a former president of the AAOP,
Hmm.
and everybody treats
Oh
everybody.
wow, I didn't know you had him on.
We just released. It's just released. So you'll be seeing it soon.
And so, we wanted just to hear their perspective because this is all about people who suffer, and our way is not the only way, although we know it's the right way, but that's okay. Um, but it was really interesting to hear their perspective because I would love for you to listen to that podcast, but
Oh,
his thought, I think, has changed, has evolved over and over again through time. And when he was with the AAOP, their stance was really about it, TMD being more from a psychological aspect. Like this is, stop making it a big deal. You need to relax and stop thinking about how often you put your teeth together or constantly putting your teeth together. I mean, we all know that there is a psychological component to all this, but um, when you've been treating your patients, like what's been your success with appliances? Do you think TMD, in your opinion, is a fixable condition? And if so, how? Or do you really think it's just purely psychological? What are your
mhm.
thoughts?
No, I think it's mostly structural, to be honest, and I think it stems from um, early craniofacial development. If we're not growing wide, flat, and forward, it's going to end up putting way too much pressure on the joints and the muscles, and we're going to end up with pain, clicking, popping, locking. My daughter's a prime example of it. I mean, she's only 9, and she was born with a severely retracted mandible, and we finally got her with a good profile, with functional appliances in her mouth. And she, before the functional appliances went in, her head was tilted She was having headache, and every now and then she'd have this neck spasm that would last for days. And so I couldn't help her. And I was like, how is the TMJ doc not being able to help her own child? Right, Pam? You know, I talk about this constantly. And so, as soon as she got the appliance, she noticed her headache changing. And we took pictures. She no longer has the head tilt.
Right.
So really, I think it's more structural and psychologically, like stress, of course, controls. And even through my treatment, people have flare-ups when they have extreme stress in their lives. Recently, politically, the Epstein stuff, Iran, like it's affecting people, and they're like, oh, I was feeling so good. And then I have this massive migraine. And then I ask, how are your stress levels? And they're like, awful. I've been crunching all day and I know I need to, I need to go back to where I was. And so stress can play a role, but that is not the primary cause. It's just not. And that's not my opinion. It's just
Agreed. It's like, Mac and I have talked about this before. When patients come to my office, we talk about dysfunction and establishing a physiologic balance with an appliance. I tell them, this is not the panacea. It's not snake oil or a magic tonic where it's going to get you your dream husband or your dream job and it makes the world a happy, better place. But when we bring back function and balance into your life, it creates a capacity for you to handle these other stressors that
yeah,
will come in and out of your life, but you will have flare-ups. It's depending on what's going on, but you will never ever go back to ground zero unless you disengage treatment completely. And,
yeah,
we have no idea what's going to happen. So,
yeah.
agree.
Well, it's interesting you say that because my wonderful office manager, her name is Julie. She's for years and years and years managed a typical dental practice, right? So this is her first client in TMJ practice. And she's like, I just cannot believe how much patients change through treatment. They come in here fearful, angry, kind of standoffish because they're in pain,
Hmm.
right? They're in so much pain. And then she's like, and then when the pain goes down, and they take treatment, the pain goes down, they're totally different people.
They're
I mean, she
funny.
commented on you. You what?
They're funny. They're
They're
actually
fun. They're fun.
attractive,
Yeah, yeah,
That
yeah.
look on their face of all this tension is just starts to melt away. And it's so funny you say that, Priya. Our front office team always notices that they're standing there and having conversations now and having a good time.
When at the beginning they're super standoffish, and so I think what's hard is because we're not taught this in dentistry, right?
Mhm.
Um, we, I, and I practiced as a general dentist only for 11 years, and then for the past since 2018, I've been doing TMJ only. And as a general dentist, I remember, I was getting my training in TMD, and I was also doing general dentistry, so there was an overlap. And I remember there was this patient in my general practice who was constantly in pain, and at the huddle, they were like, "We think she might be seeking, like she's seeking blood." And I was like, then I sat down and really had a conversation with her. Yeah, no, her TMJ was severe, and we just didn't recognize it. So it's like we're even doing the gaslighting without realizing. Because a year previous to that, I probably would have agreed. Like, oh yeah, she just wants some strong pain. And then when I sat down and talked to her, she was like, I don't want the pain meds. I'm just in pain. And then we had this conversation. She's like, it kind of helps. So that's why I asked for them. But she's like, I really need treatment for my jaw. We got her into treatment. She's feeling a lot better. And the front desk noticed right away, like, she doesn't ask for anything anymore. So it's hard because it's like we're not, primary care or regular medical doctors, and then dentists in school, we aren't taught about things. So it's very hard to recognize.
Hmm. Yeah, I mean, again, mostly in dental school, we're all taught just about night guards and grinding, and never
Mhm.
the cause of why people actually grind their teeth. That took a lot of education and mentorship from other people, postdoctorately, right?
Yeah, absolutely.
And you have
Now,
to
one of
watch.
my experiences is that these patients that once you do exactly what you said, you palpate and and you're using a lot of soft skills. You're right in step with the patient as I was in step with you when we had our phone call. And that is so powerful and so important. And you can just watch the relief in their face. They come in and you can see pain. Don't tell me you can't see pain, but if you're looking, you can see pain in the face. And then once they find out that they can trust you, And once they understand what's going on, the lights come on, and there's just a physical change in the way that they look. And that's when the tears come. And to me, that's when the healing starts.
Right.
And my message to those who are listening, those pain patients that are listening, if you walk into a new doctor and you don't feel that, you might as well turn around and walk out.
Hmm.
Anybody agree with that?
Absolutely. Absolutely. Things that Priya was just touching on how this all starts from a very young age through improper craniofacial development or just an underdevelopment, we should really say. You get these patients who have had a chronic condition all their lives, when it was just craniofacial compression, like a lack of development. It's heartbreaking. I saw just recently the 72-year-old female Joyce. This was hands down. I thought the trigeminal ablation cases were tough, but this lady, when I saw her CBCT, I'm like, I have no idea how I'm going to do this. And I told her because she had orthodontic surgery, jaw surgeries, where they removed the part of the mandible that has the condyle and the entire neck, the ramus, right? And it was metal, all metal. So she can only chew up and down like a rabbit. And her only like how they on that intake, there's all these check marks on them, like they have blurry vision, headaches, everything. So I always say, okay, if there's just two things out of all these things you've checked off, just two things that you want me to see if I can get rid of or make at least 80% better, what would they be? And this older lady says to me, because she lived alone, I just want to be able to talk on the phone with my friends. And I'd love to be, number two, I'd love to be able to finish a meal. Come on, come on. And then
Mm.
you look in her mouth and she's just completely crowded, overclosed, upper central teeth are tipped in. She's completely compressed back. And I was like, our typical muscular, neuromuscular, and joint understandings do not pertain to you. So let me just see what I can do. And I still tensed her, took a bite, and did the best I could. And she is 3 months into treatment. 2 months ago, she told me she can have hour-long conversations on the phone and how much she enjoys being able to eat food. And she's stabilizing, doing really great. And I wish for her to go through orthodontic treatment. I don't know anybody will touch her. And that's the sad thing. She's like, nobody was willing to touch me. They looked after all of that she's been through. Nobody was willing to touch her, and they're like, you have to live with this. And I think what the three of us do, um it just is, it's so near and dear to me because she's one of thousands of stories that I'm sure we can all share, that
Millions.
are people are being normalizing their condition to the point that they're lost, to dark places where sometimes if we just find where they can physiologically be balanced, even if it's so broken, you can really improve that quality of life. And Bria, I love you for all that you put out there and all the hope that you give to people. It's just, to me, is just as important as what you're doing clinically for the patients in your office, because people really need to hear these things. So, thank you so much. I'm not closing us right now, but I just want to say thank you so much for taking the time to being here.
And,
Appreciate
and
you.
I totally agree. And I do have a question. What have you learned about the pain patient, from afar, from all the social media? We know what they need, but the education wise, what is it that we can do to get them to really understand what's going on and to seek the proper help, like the three of us or two of us?
Yeah, I mean, I usually refer them to, a lot of my videos that explain where the pain is coming from, or if they want the video consultation with me to explain it to me too, because a lot of them, the main thing that I see is they've been gaslit or told that it's like just in their heads, and if they decrease their stress levels, it'll go away. And really, they're being told by people, practitioners who don't understand what's causing the pain, right? And so I feel like if they can start to understand what's causing it and if there is a solution, then they're more motivated to seek out food. The hardest part is if they're not local, telling them where to go.
Right.
I again, handful of referrals around the country for me, and then really none in other countries. So I had a patient who came to see me from the UK, and I discouraged her. I was like, please don't come because it's a lot of pressure. I mean,
It,
I knew from our online talking, she was locked closed and had been for a while. She had her canines extracted with her.
oh,
I mean, this,
Mm.
and she's so pouted, narrow palate, smallest little jaw and face you've ever seen. And I just said, don't come because the only way I know how to treat that is when I see you regularly, do jaw manipulations, get you unlocked. And she said, I can only come one and done, get the orthotics, and I'm leaving. And I said, I don't know if it'll help. And I said, you're welcome to come, but I wouldn't encourage it. And she came and she got the orthotic and she can chew and speak and function. If she's unlocked, I don't know. She's in the UK. I would love to check her range of motion here again, but I feel like it's so important when they understand that it can be proven. Now, that and again, that's why I created my courses is to train dentists in other areas on how to diagnose and treat. And a dentist locally has said, "Well, why did you limit your courses to people outside of Washington and Oregon?" Because I'm here.
yeah.
Why would I go
Hello.
to when there's somebody suffering in like Florida?
Yeah,
Why would
exactly.
I teach a Florida dentist? I'm not being selfish with my knowledge, but I'm being practical with like what patients need. So I know I've been off track.
Well,
That's
okay,
good.
so I love the fact that you're not shy and you just put it all out there and you're very real
Yeah.
about things, right? So let's talk about a couple other things. In your opinion, when a TMD patient, okay, dysfunction patient goes to an ear, nose, and throat doctor, what does the ear, nose, and throat doctor usually do for them?
The ENTs in this area are very adept at recognizing when it's TMD versus an ear problem. So they say, typically they say the ENT said that my ears were clear, and then they sent me to you. So luckily the ENTs in this area can recognize that. I found most of them, but sometimes I hear, I had a lot of pressure in my ears and they put tubes in and that didn't help at all. Or, they treated me with antibiotics because I had ear pain. And even though they didn't see signs of infection, they were just like, let's try this to see if it goes away. And that antibiotics didn't help. So it kind of hurt it all.
Because, a lot of these patients start with an ear issue, not all of them, but quite often. So they go to medicine first, thinking it's an ear issue. And if they are astute, they do a quick examination, sometimes give them medication, and then they refer them out. What is the neurologist? Because that's the next one they go to. What do neurologists typically do? What have you found over there?
Botox, gabapentin, and have no knowledge of who I am and no desire to have knowledge of who I am. That's what I found.
Me too. They don't know who I am either. I'm trying.
I'm pretty cool, girl, but like, there's an ego thing with MDs, and she's just a dentist, and a female dentist at that, and that does matter. And so I'm just like, I don't have time to chase down neurology. Like, if they figure out who I am and how I can help, great. I just don't have time. But it's frustrating. It is frustrating that a lot of you can say a lot of MDs won't think outside the box, and those are actually my most difficult patients with MDs. I don't like it when I see what they're an MD. A few of them have been very open to a different approach, but a lot of them have been like, just give me Botox and some medicine and we need to go with it. That's not gonna work.
Yeah, there'll be temporary relief, but it'll come back and worse.
Yeah.
And we've talked a lot about how so much of medicine and dentistry is truly fragmented. Most people don't have the time. I would like to think they care, but they don't have the time to listen to the patients, like you're saying, and understand their history. They don't have the time to talk to other doctors to find out what's going on and collaborate. They don't have the time to go and learn more. And that's unfortunate and devastating to all these patients that suffer. And again, I love our little nerd organization, ICCMO, because we have different type of practitioners come. It's not just dentists. We have had physical therapists, chiropractors, polio specialists. We've had all kinds of myofunctional therapists, lactation consultants. These are people who actually care, and it's tough. That's not going to be the norm. And you working with other doctors outside your state to spread the knowledge, I think it's brilliant. Like you said, if you're already there doing the best you can in that radius, keep spreading the word, and hopefully more people can get help, right?
Yeah,
Right.
that's the whole last at my last course, we had a dentist from Kentucky. We had two from Pennsylvania. I mean, they traveled, and we had a few from California, which I was happy to do. That's close to me too, guys. So it's not a, look, recently I had someone say, well, she doesn't even teach dentists nearby. Oh, really? Because it's about the patient.
Right.
It's about more patients. So we had a dentist from Toronto. So it's been really cool.
That's fantastic, Priya.
And these dentists found you through your social media?
Yeah, so I started putting out there in the socials that I teach courses. But before I developed the course and started teaching it, I had many dentists reach out and say, do you have courses? Do you have courses? Do you have courses? And my next thing to do is make courses online because a lot of people can't travel. Like I had a dentist trying to figure out how to get here from Australia and she has a young child. I even gave her a discount on the course. I was like, I'll cut off this much. You just come and learn because I get a lot of people from Australia asking me who to refer them to. She just couldn't make
You
it work.
do.
So my first whole day of the course was about diagnosis because if you nail the diagnosis, you can help them a lot, right? And so if I can make that online, because that's just me lecturing, that's my talking head. I do that all day. So I can make that part of the course online, but to learn the hands-on part, I do a lot of hands-on facial manipulation, massage, intraoral work, jaw manipulation. You have to come to me.
That's really exciting, Priya. That is awesome. Just keep doing what you're doing, girl.
Absolutely.
So final thoughts. If anybody wants to find you, okay, how can they find you if they haven't already? Okay.
Yeah,
For patients listening and doctors, what are the best ways to find you?
you could just Google my name. So many videos pop up, but at the underscore TMJ underscore doc is my handle on Instagram and TikTok. I have a YouTube channel called the TMJ doc, www.tmjdentaldoc.com. That's my website. So it's really not hard to find me. And I'm on every platform.
Thank you, Priya. Okay, so for those of you listening, if you're suffering, you know how to find her. She is easy to find and a wealth of information. And for you doctors wanting to learn, this is one of the brand new educators in the field, official educators now. So search her up. Priya, thank you so much. It was a pleasure having you.
Well, thank you, Priya, for the work you've done
Thank you guys. Thank you
and
so much.
doing.
All right, take care. Bye.